Thank you all for signing up for your group projects. And in this learning unit, we're going to look further at data that you're going to find very applicable and helpful for your health promotion groups. But we're really focusing in on our role in health promotion. That's the nurse's role in health promotion. We know that it's essential to healthy living, but yet it's often overlooked in healthcare. And even hospital nurses, and especially hospital nurses, have to be informed about health promotion priorities, needs, and activities of their community to best care for their patients. So let's look further at learning unit number 3. So you're watching this video, the introductory video. The next thing you want to look at is your learning outcomes. So you want to describe the role or be able to describe the role of the nurse in assessing health and health behaviors and why a community health assessment is done. So we're focusing this learning unit on community health assessments. We're not focusing yet on the plans based on that assessment, but we're focusing on the assessment. And you're going to better understand the AI policy for this course and look at priority health issues and so those priorities of the residents of Erie County, Pennsylvania, based on the community health assessment that was done in 2025. So you're going to review all the articles and websites and documents that I'm going to go over in a minute. And we are starting working together on our health promotion group's next learning unit number 4. So in this learning unit, I want to make sure that everybody shares their contact information with your group members. So if you don't know your group members, share how to get a hold of you, what times are best for any meetings, or how you're going to share information and talk with your group members. I also want you to begin to independently explore the information that we're going to be looking at that may be applicable to your group. And then the discussion board post is due by Friday evening, but no reply is required. But I do ask that you try to read your group members' posts as well. That's why I'm still asking for a Friday. So the first thing that we're looking at is community health assessments. What is a community health assessment? So this is a video. It's an older video, but it gives you the information that will help you review the data that we're going to look at next. It's like a 10-minute video, but you can end the video at 8 minutes and 35 seconds to be exact. So you click on here and it'll take you to the link. So the next thing that you're going to look at is this is important that you read it. This is from Erie County Department of Health, and it tells you a little bit about what is a community health assessment. It tells you that it requires community engagement throughout the process, and the aim of doing a community health needs assessment is to help identify what they call targets, priorities. What do we need in Erie County, Pennsylvania? What do we need to focus on? There's a lot of health needs, right? But what are the critical ones for our location, Erie County? So the process of the assessment was done in 2025, and now they're working on the actual plan. So I'll let you look at that. But there were there were health needs and priorities that were identified. And these are just basically chronic diseases and having behavior change. So you can look at that. Early detection, prevention, and control of these specific diseases, and then issues regarding maternal and infant health. So, based on the assessment data, they are in the process of working on the plan. It's not yet available. So, please reread that. I went over it very quickly, but I'd like you to read that. Then you can see I've got my cursor over here. There are 3 websites. They're actually all the same, but I have them kind of spread out so that you can look at the data independently. So first of all, you're going to look at the information in demographics and the social determinants of health. And when you click on, you're going to get to the website. Shoot, you can't see the top toolbar, but there is a spot for demographics. So you want to look through this information and take your time. And please know that you'll come back to this as you do your group work. But be thinking of what group you're working with in Erie County. And you're going to be looking at the demographics. This is all based on some great information, so you can see and you can interact with some of this data, the ethnicity, race, age, gender. You're then going to look at the social determinants of health. And we're going to talk a little bit more about the social determinants of health, but what impacts on health socially. So we know that, yes, there are diseases, but what else impacts on our health significantly? And that's income. So you can begin to see overall in Pennsylvania, the median household income is 76,000. However, Erie County is a lot less. So you can look at that. You can look at poverty is a big part of Erie County. You can look at the zip codes. You can just review some of this information. We know educational attainment, what degree one has attained educationally, and whether or not you're employed and employed full time. Those are also social determinants of health. So it tells us a little bit more about what's the educational attainment of Erie County residents, and then employment data too. So you're looking through this information, and let's see. So that's under the demographics and social determinants of health. You could access this another way just by staying on that site, but I am going to take you to another link of the same information, and you're going to look at health outcomes, but only specifically to chronic diseases right now. Okay, so you're clicking on, you're taken to the health outcomes section, and then you're going to look at the information on chronic disease. And again, this is going to give you some of the major, most common chronic diseases, what they are and what the percentage of our population has, whether they've increased, decreased, a little dashboard. So I'm going to let you review that data. And again, remember, you can come back to this information as you work on your groups. It's very helpful, and it's brand new data. This just came out. I know it says 2025, but it did just come out. And then the next one, you're going to look at the data under lifestyle and access, but very specific to healthy eating and physical activity, because you know that's a big part of many of your groups. So this is, again, Erie County of Pennsylvania. The Department of Health talks about health behaviors and conditions that's going to impact on the health of Erie residents. and you're going to read about You're going to read about healthy eating and then physical activity. So you can get to that information below, and I'm going to get out of here right now. So why are you looking at this information? Because our county, where we are right now, whether you reside in a different state, it doesn't matter where we are right now. We are in Erie County, Pennsylvania, and we have recently done an assessment about the health of the residents. So for your discussion, you're going to note that a community health assessment is a way of identifying needs, priorities, and resources. We're not quite looking at the resources right now, but resources as well of a community using data. So this is data. This is accurate, recent data that we're looking at. And after watching through and watching the video and looking at the information that I just reviewed with you, but reviewing it yourself, what data did you find that is applicable to your specific group and supports the need for your group's health promotion program? So that's why you do need to go back and really look at this. And you're going to post by Friday evening. No reply is required, but remember, if there's no reply, your answer is going to be a little bit longer, a little bit more in depth. And then we're going to do one last thing. And I wanted to go over, we have a policy for AI in this course. So I just, over the summer, gave a course to our master's in nursing students in the education program about AI for leaders and for educators. And their use of AI, of course, in this specific course was different. But I do agree that you can use AI to do certain things in this course, to generate ideas, to brainstorm. You can register for ChatGPT, which is free through OpenAI, but you must cite the use of AI. That's my biggie. And please note that you're learning as you go through this course. I'm going to provide you with feedback. But you can't submit any work generated by ChatGPT or Claude or whatever AI tool you may be interested in using as your own. That's what's not allowed. That's called plagiarism. So if you're using AI to brainstorm, you're going to cite it. And there's a way to cite it. And I have that way right here. You're going to say OpenAI 2026, ChatGPT response to, what was your question? What was your prompt? And so you can see it here. This is an example. And then please note that there is more information, but I just want to make sure that you at least attempt to say that you use ChatGPT, but you're not developing your health promotion program, or ChatGPT is not developing your health promotion program or your presentation. That's just not an effective way to learn. But it can help you, and it can revise what you've done to some degree. You have to assure that it is accurate, but it can definitely assist you, but it is not to be doing the work. So please note that, and please note that you do have to cite ChatGPT or Claude or whatever you're using as far as an AI tool, if you're using an AI tool, just as well as citing your textbook or citing an article. So I'll get off my soapbox. That's a pretty old term. But anyways, thank you for sticking with us and for really looking at the needs, the assessed needs of our community. You are wonderful healthcare providers when you're looking out for others. That's a compassionate nurse. So have a good week and contact me if something isn't working or you're confused. And next week we will start working together as groups.